Doctor, the role of herbs, is that basically to help boost the immune system? Is that the reason why a lot of these diseases take hold?
The reason a lot of these diseases actually take hold is because of the medications that allopaths are using to treat the diseases. As I said before, aspirin is a simple example. You put somebody, because they have a heart problem, on an aspirin a day, and they develop a peptic ulcer from it, or they bleed from it. And instead of using total willow bark, which has exactly the same benefits but none of the side effects. So we try to educate the physicians and the patient. That's one major difference between allopathic and naturopathic medicine. The number of lawsuits against naturopaths, is virtually unheard of. The rate of lawsuits against allopaths, now they're talking about, we've got to reform the lawsuits. How about we reform the medicine? It seems like a more obvious approach. But the reason is that allopaths treat symptoms. That's what we're taught to do, treat symptoms. If they have high cholesterol, we give them a statin. If they have a high fever, we give them medicine that'll stop the fever from progressing, when the fever is actually what our body's trying to produce to kill the invading organism. In other words, it's all symptomological medicine, all memorized. And if you can't remember the newest drugs, and I can't remember half of the new antibiotics that come out, half of the new antifungals that come out, then you have it on your palm-held iPad that you can scroll through and see. That's good medicine. No, that's not good medicine. Naturopaths treat cause. We always look for cause. When we treat cancer, when we treat any disease, we look for the cause of cancer. We would look for the cause of the failure of the immune system. That's why I say we would do hormone profiles. We would do lymphocyte subset panels. We would do the tests I mentioned before, simply because we want to find the cause of this problem. I have never seen a cancer patient that didn't have either or both a fungal infection that they'd had for quite some time, or a bacterial infection they'd had for quite some time. Now, fungal infection, fungi love the same environment cancer does. Love sugar and love acidic environment, just like cancer cells do. Bacteria require a whole different part of our immune system and is recognized as a more imminent threat than a cancer would be, because we're producing cancer cells all the time, but our body sees a bacterial infection as a real quick life threatener, and it can be. So our immune system switches over to fighting this bacterial infection while they're developing cancer. So unless you get these primaries, or find these primaries, and there are several ways to do it, several tests you can do, you want to get rid of the bacterial infection, you want to get rid of the fungal infection, in order for the body's immune system to be able to put cancer in the forefront and fight that disease.